Welcome to the medical terminology video focused on the cardiovascular system, brought to you by Synergy Medical Coding Academy. We are beginning our discussion on the cardiovascular system. The cardiovascular system includes the heart, the arterial system, and the venous system. The heart structure is composed of three layers: the epicardium, the myocardium, and the endocardium. The heart also contains four chambers: the right atrium, right ventricle, and left ventricle. The heart also features several valves, including the pulmonary valve, aortic valve, tricuspid valve, and mitral valve, which regulate blood flow. This illustration shows the direction of blood flow through the heart's chambers and valves. This diagram further illustrates the systemic and pulmonary circuits, highlighting the path of oxygen-rich and oxygen-poor blood. The cardiac cycle involves three main phases: relaxation, atrial systole, and ventricular systole. The heart's conducting system, a network of specialized tissue, includes the sinoatrial node and atrioventricular node, allowing the heart to contract without external innervation. The first heart sound, S1 or lub, is the closure of the mitral and tricuspid valves during systole. The second sound, S2 or dub, is the closing of the aortic and pulmonary valves during diastole. Blood pressure includes systolic pressure, which is the pressure when the heart beats, and diastolic pressure, the pressure when the heart is at rest. Normal range is typically 1/128ths of a millimeter Hg. The circulatory system comprises arteries, arterioles, capillaries, venules, and veins, which transport blood throughout the body. The coronary arteries, including the left and right coronary arteries, supply blood to the heart muscle itself. Symptoms of cardiovascular system issues include chest pain, breathlessness, palpitations, bradycardia, tachycardia, cyanosis, syncope, fatigue, edema, and anasarca. Now let's discuss common investigations used to diagnose conditions of the cardiovascular system. Common blood tests include a complete blood count, or CBC, a lipid panel, and a troponin test, which is a key marker for heart muscle damage. A chest X-ray provides an image of the heart and surrounding structures, helping to identify issues like an enlarged heart or fluid in the lungs. An electrocardiogram, or ECG, records the electrical activity of the heart. The diagram illustrates the components of a normal ECG waveform, including the P wave, QRS complex, and T wave. A treadmill stress test monitors the heart rate, breathing, blood pressure, and ECG while the patient exercises, helping to assess the heart's function under stress. CT coronary angiography uses CT imaging to visualize the coronary arteries to detect blockages or narrowing. A 2D echo of the heart, or echocardiogram, uses sound waves to create moving images of the heart, assessing its structure and function. Cardiac catheterization is an invasive procedure where a catheter is threaded through a blood vessel into the heart to measure pressure and oxygen levels. Angiography involves injecting contrast dye during a cardiac catheterization to capture X-ray images of the blood vessels, revealing their structure and any blockages. We now shift our focus to common cardiovascular diseases. Infections and inflammatory diseases include endocarditis, myocarditis, pericarditis, arteritis, and phlebitis, each affecting different layers or vessels of the cardiovascular system. Cardiovascular neoplasms can be categorized as benign tumors or malignant tumors. Hypertension, or high blood pressure, is a major risk factor for cardiovascular disease and is classified based on severity. Complications of hypertension can affect various organs, including the brain, eyes, heart, and kidneys. Atherosclerosis, or arteriosclerosis of the coronary artery, is characterized by the hardening and narrowing of the coronary arteries, often due to plaque buildup. Atherosclerosis is the buildup of fats, cholesterol, and other substances on the artery walls. Angina pectoris is the medical term for chest pain or discomfort resulting from coronary heart disease. Ischemic heart disease, or IHD, includes angina pectoris and is caused by ischemia, a decreased blood supply. Myocardial infarction, or MI, refers to the death of heart tissue due to ischemia. CVA, or cerebrovascular accident, involves cerebral infarction, which can be due to cerebral thrombosis, hemorrhage, or embolism. Pulmonary valve stenosis is a narrowing of the pulmonary valve, hindering blood flow from the right ventricle to the lungs. Peripheral arterial disease is a circulatory condition where narrowed blood vessels reduce blood flow to the limbs, often caused by fatty deposits. Diseases of the veins include deep vein thrombosis, or DVT, which involves blood clots forming in deep veins. Varicose veins are characterized by the engorgement of veins, usually in the legs. We will now review several common cardiac procedures. Angioplasty is a surgical repair or unblocking of a blood vessel, most commonly a coronary artery. Coronary artery bypass graft, or CABG, is a surgical procedure to create new routes for blood flow to the heart muscle, bypassing blocked arteries. Pacemaker surgery involves implanting a device to help maintain a regular heart rhythm, treating conditions like arrhythmias. Endovascular aneurysm repair, or EVAR, is a minimally invasive procedure to repair an aortic aneurysm. This concludes our video on medical terminology for the cardiovascular system. Thank you for watching.